We will now discuss screening tests that are offered to your newborn baby. It is important to remember that in order to provide informed consent for screening tests to be carried out, you as a new parent will need to understand the purpose of the test. Screening tests are used to find people who may be at a higher risk of a health problem. It is your choice whether your baby does or does not have some or all of these tests. Similar to the antenatal screening tests you may have had in your pregnancy, we offer your new baby screening tests in the first few weeks of their life. These can identify if a baby is at an increased risk of having a health condition, and if detected, plan effective management. Further diagnostic tests after a positive screening result will give a more certain answer. The NHS recommends that every baby born in the UK is offered these screening tests. This is based on research evidence. There are no known risks associated with these recommended screening tests. Among the first of these screening tests is the newborn and infant physical examination. You may also hear this referred to as a neonatal physical examination or a paediatric check. This is performed by a qualified midwife or paediatrician before your baby is 72 hours old. It is a top-to-toe examination focusing on looking for problems with the eyes, heart, hips, and in baby boys, their testes. The test may be performed in hospital before discharge, at home by a midwife, or at an appointment at the hospital. This screening test is repeated by your GP at the 6 to 8 week check because some conditions do not appear until then. A hearing test is offered in order to identify babies who have hearing loss from birth so that support can start early. Often this screening test is carried out in the hospital prior to discharge home or at a scheduled appointment in the community. The results are available immediately after the test. It is often done within the first few weeks of life, but can be done up to 3 months of age. The equipment used is very sensitive, and in some cases, it may need to be repeated at a later date in order to obtain a conclusive result. All babies are offered a blood test in the form of a heel prick in order to identify some rare but serious health conditions. These include sickle cell anemia and cystic fibrosis. Early identification and management of these inherited conditions can improve babies' health outcomes. This screening test is usually performed on day 5 using a special device to collect some drops of blood onto a card. All screening tests are only performed with your informed consent, and you should be fully aware of the implications of both having and not having the screening tests. The results of these postnatal screening tests will be documented in your baby's personal child health record, or Red Book. If you have any questions about the postnatal screening tests offered to your baby, please do not hesitate to ask your midwife or health visitor.